Hi, my name is Jeffrey Kleinberg. I'm the retiring president of the American Group Psychotherapy Association. And with me are my three colleagues and friends from Shanghai, China. And it was my privilege to work with them as part of the American Group Psychotherapy's outreach program. I've been to China several times now, and a very exciting experience for me was to participate in training at the Shanghai Mental Health Center.
Yes, from 2006, after the 1 week training, so we started our group. And not only in the outpatient clinic, but also in our inpatient clinic. And I find in our inpatient clinic, yes, every patient, they took part in the group twice a week, and every session is 90 minutes. And the patients, they very involved in the group, and they like the group very much. And it's very interesting. After everyone attend the group, they could express a lot in the group, positive and negative. And after that, no one to go to the administration to complain a lot, because they complain a lot in our group. So it's very I think effective. So in our unit, combined with the medication, so other psychotherapy, not only the family therapy, individual therapy, but now the group therapy is most welcomed by the patients.
That's really great to hear. Perhaps you could describe what the training was like, because you were part of the training. You helped not only serve as a translator, but as a cultural navigator to help the AGPA members understand the culture of the people we were talking about.
Yeah, just as Yong mentioned, Dr. Ann Alonso and Dr. Koff in 2006 first come to our center, give us a 1 week training. It's so impressive. All my colleagues really enjoyed that. Then later on, we just think about it because, I remember then in the early of 2006, Yong and I, we went to the Austin. It's really broadened our vision. So exciting. Also feel group therapy is so useful. So we came back. Then we think about how we develop the formal training in Shanghai Mental Health Center. So then we can start our cooperation with AGPA. So you, Lina, so we established such kind of training program. Xiong in charge of this training program, and this is really very influential with good qualities. It's welcomed by the colleagues from China. Also, I think not only from the AGPA, also in the other training program. Now, like we have another dynamic psychotherapy training program. Also, we just combined with group therapy training. So now more and more people realize group therapy is very effective and useful, cost-effective therapy. So I think has a very promising future in China.
How do you think the difference in cultures between China and, let's say, the United States, how does that affect the place of group therapy in China and also the kind of training that is needed? What's the effect of the different cultures in terms of training?
Yes, in terms of the culture, because I think people will think Chinese people are more group or family or collective oriented. So I think this group really how does it fit in China, and but on the other side, I think because the traditional Chinese people are not so open to the others, especially in terms of the group. In China, we have this, for the group, we have the inside and the outside. That means for the Chinese people, for the psychotherapy group, it's really a challenge for the Chinese people. So that means at the beginning, if you want to forming a group, it's very difficult. But when the people join the group, I think this is really the good or right place for them to explore their emotional or internal world. That's I think this for Chinese people are very new.
What do you see in the future for the cooperation between AGPA and Chinese mental health professionals? What does the future look like? What do you need, and how might AGPA continue to help?
I think we should continue. Yes, of course, continue as training programs together with AGPA, and I think Chinese group psychotherapists need the standard certification. So we should establish the certification system in China, I think. And under this system, then we could develop more different school of group psychotherapy training.
So there might be diversity of approaches to group psychotherapy in China. I also am very impressed with the friendship that we've all established when various AGPA people have gone there. To me, it seems like a natural friendship built on mutual understanding and common values. So it's meant a lot to us, and it's very wonderful to hear that it's meant a lot to you. So perhaps I could ask my dear friend Yong for the final comments.
Yeah. So we are very grateful to the AGPA and to Professor Anne Alonso. We very missed her, and very grateful to many experts in AGPA like Professor Priscilla Koff and our dear friend Jeffrey Kleinberg and Dr. Nina Thomas and many. And we really want to continue this the friendship and of cooperation. Yes. So thanks. Many thanks to the AGPA and our friends in the AGPA.
Thank you all, and we're delighted to have you in this country, if only for a little while.
Thank you.
Thank you.